For those viewing this presentation, take comfort, as we have the president and founder of South Bay Health Insurance Services, or SBHIS as we call it, Pat Salas, here with us today. Thank you for joining us, Pat. Tell us, what is SBHIS and how can it help our seniors through COVID-19?
Of course. SBHIS is an insurance agency that specializes in helping people with MediCARE or MediCARE and Medi-Cal find a plan that best suits their needs. We do this by reviewing your benefits, comparing them to other products, and helping you find the one that makes the most sense for your individual case.
Thank you for telling me about SBHIS, Pat. Now please tell me, how has COVID-19 affected our seniors with unemployment?
Well, it's affected seniors in many different ways. Unemployment is one of them, but let me start at the beginning. Seniors, in my opinion, are the most affected population when it comes to COVID-19 because they are the ones who are at the most risk, right? Anyone 65 and over has been asked to shelter at home, has been asked to stay inside as much as possible, and there is a lot of fear of becoming sick, picking up the virus, and having some really horrible outcomes. So what they've done for the most part is they have they're at home, but they are lonelier than they've ever been. They are extremely anxious. They are not exercising, so this is affecting our diabetics. For example, we're seeing increases in their A1C. People who had controlled conditions and were used to taking walks, were used to exercise, were used to socializing at a senior center, participating of an exercise class at the Y. All of those things are not happening right now. And even as the community opens up, they are still being asked to stay at home. It is horrendous. It is horrendous because it's causing mental problems. It is affecting your behavior, right? It's affecting your mental health because it's not healthy to be locked up for so long. We were able to get a hold of thousands of flower bouquets, sunflowers, and we went out and we have now distributed over 20,000 flower bouquets to seniors, and we were in complete PPE, so protective equipment, wearing the masks, the shield, the gloves, etc. And we went to mobile home parks, we went to senior housing, and we dropped them off, and we were met with smiles from ear to ear. We received phone calls from many of them because we couldn't engage in conversations for a long time. They would call us and they were grateful, and they said, I haven't seen anyone in so long. These flowers made me smile. Thank you. That was the beginning of a number of things we've been doing to help them because it was so touching and so moving that we're using it as part of our senior sensitivity training with our agents. They're out in the community, and I don't know if you've seen the picture where there's a senior inside of the home and they put their hand on the glass and then somebody else touches the glass from the other side. All of my agents have done that exercise. And when you do that, it changes you. It changes you automatically because it shows you that you're out there servicing a human being, and that a little compassion, a little empathy, and a little kindness go really far. More than likely, you have not taken Medicare Part B. You have Medicare Part A, which was automatic, but you didn't take Part B because you were still working, you probably had insurance from your employer, and you didn't think you needed anything else, right? To all of you, I suggest, it's confusing to explain, but my number one suggestion is call the number that's on the phone and allow one of the agents that is very, very aware and familiar with the situation to assist you. Number one, we have extensions from Medicare and from the Social Security Administration in order for you to file for that Part B. So because you've lost your employment, you can now go in and say, hey, I need to turn on my Medicare Part B and have access to products and services through my Medicare. So that's number one. If you lost your job, you're over the age of 65, and you had creditable coverage, we have time to help you apply. Please call us. We're very familiar on how to do it. In fact, we can even help you complete the application online. So that's one of the things we'll do for you.
Thank you so much, Pat. And I know for those who experienced a loss of coverage, this can be an incredibly difficult time for you. Please know that Pat and her team at SBHIS are here as a resource to assist. Pat, please inform us, what are the ABCs and Ds of MediCARE?
Sure. So Medicare is made up of two parts that are extremely important. Medicare Part A, which covers hospital services. Medicare Part A is something that you earn. It is traditionally earned when you do about 10 years of full-time work and pay into the Medicare system. So it's those deductions on your paycheck that say Medicare, that's how you get Part A. If you didn't work and you were the spouse of someone who did, then you're entitled to it the same way.
Wow.
Upon turning 65 usually, or when you decide to retire post 65, you need to turn on your Part B. Your Part B has a monthly fee. It varies based on your income. Most people pay about $130 a month. It is automatically deducted from your Social Security check. Once you have Medicare Part A and B, you have what I call active Medicare, right? That's my own term. And when you have that, it means that you belong to this club in the US that allows you to go to any doctor that accepts Medicare with some copays and deductibles that you're responsible for. So it's quite expensive and it's not recommended by any means, but it does allow you to have access. So what happens once you get Medicare A and B is you have three options. Option one, do nothing, keep the card in your wallet and take on this huge risk. If something really serious happens to you, that's expensive. It could be thousands or hundreds of thousands of dollars that you could be responsible for. If you have a home, if you have savings, etc., this is how you could use it all up. So not a recommended option, but an option nevertheless. Option two is to purchase a Medicare supplement. A Medicare supplement fills the void of what Medicare doesn't pay. So we just talked about Medicare being expensive and possibly eating up your savings. If you have a Medicare supplement, it covers up to 20% that Medicare doesn't cover. And that's it. You're not responsible except for some minor co-sharing in some cases, and you have options to choose from. But it has a high premium per month. So a Medicare supplement could run you anywhere between $160 to $400 a month, depending on how old you are. Your third option, and the most popular one in California, to join a Medicare HMO or a Medicare Advantage plan, also known as Medicare Part C. When you join that plan, the plan offers you a set of benefits. And the only thing that you become responsible at that point is whatever copays those benefits come with. So if hospital is zero copay, then your copay is none.
Wow.
If the doctor has a $5 copay, then you pay $5. That's it. That's all you're responsible for. However, that freedom to go wherever you want, whenever you want, goes away. Under a Medicare Advantage plan, you must choose a primary care physician who is attached to a medical group. In this case, we're talking about Sierra Medical Group, right? So we would choose Sierra Medical Group. We would choose a doctor within Sierra, and then we would have access to the specialist network contracted through Sierra. And that's what the patients need to know. Now, what's going to be important for them is not only do you have access to fantastic providers, but you have access to a number of supplemental benefits, things that, include meals after hospitalization, transportation, vision, dental, and the list goes on.
What are the most important benefits that seniors care about?
So when you join a Medicare Plan C or a Medicare Advantage plan, most of them include Part D, which is prescription coverage. And the number one question for seniors today is, what is the cost of my medications? Why is that important? For the past 15 years, we have told the doctors to get the members on specific cocktails in order to stabilize their conditions. We've told them to take their meds, be consistent, persistent, and that we're going to improve results. And it's worked, right? We've taken them from a number of brand medications to generic medications and other things. So because they feel that these cocktails being a mixture of prescriptions that they're taking, because most of them take a minimum of 4 to 5, right? Some of them take up to 12. Because they feel that this cocktail is something important to them, they ask immediately, hey, how much are you charging me for my medications? And one of the things that I've specialized in and I've trained my team on, it's Part D, which is reviewing medications and understanding the different categories that go into it. Most of our seniors live month to month. So when you add a $250 expense, they can't take it. They become non-compliant patients because they're not taking the medication that the doctor's asking, and they see the health of the person begins to deteriorate a little bit because they need something that is quick and can assist them, right? So that's where we come in. We're able to sit down with you and say, look, we can keep your doctor, we can keep your specialist, we can keep your other meds, and on top of that, we can find you that Trulicity, as an example, at zero copay, therefore not affecting your pocket. And that's the beauty of understanding formulary. And there's one more thing to mention when it comes to our seniors that have that middle income. Their income is not low enough to receive Medi-Cal assistance. So they have MediCARE, but no Medi-Cal. So their income is probably above $800, right? However, they're in this middle group who goes between $850 to about $1,500 for a single person. If you fall in that area, you qualify for low income subsidy. To me, that is one of the greatest benefits. It's the right of every person that has Medicare. It's just, what's your income? You qualify for LIS. It's a simple application. Anyone on the SBHIS team can help you do it. When you apply, all of your medications drop anywhere between $2 and $5 in copay.
Wow.
Exactly.
That's
a huge wow.
Wow.
That is the biggest thing to me, every single one of you watching. If your income is between $800 and $1,500 for a single person, call right away. So take someone who makes $1,500, and this is a true case. The lady makes $1,500 every month, so she does not qualify for Medi-Cal. The lady takes Trulicity. The lady qualified for low-income subsidy, so we were able to drop the cost of all her meds, which to her was a blessing, right? $500 goes into rent. She used $500 for food and transportation, and she had $500 to get around, maybe buy a book, buy a plant, do things, but you can see the money being quite limited for this lady. What happened was her grandson, who has a newborn baby, lived in an apartment that's $800 a month. He became unemployed, and his wife was already not working because of the new baby. She today covers $500 of her rent and pays $800 so that her grandson can live in his apartment. You can see that she's left with what, $200 to survive a month. So she doesn't qualify for Medicare and Medi-Cal, but she's trying to help her grandchild make it through this very difficult time. And that's the truth of COVID. Do you understand what I'm saying? It's people like her that we need to help because she doesn't get any additional assistance. She doesn't qualify because she has a check, but she chooses to assist someone else because they're family. So if it wasn't because we made her meds LIS, she wouldn't be able to take medications. If it wasn't because we helped her find a food bank and collects eggs, bread, cheese, and other basics, she wouldn't be able to make it month to month. But that's what's happened with her. And like her, there are millions of seniors in the country that are barely scraping by. And there is assistance. Please, if you're watching this, allow us to help you with low-income subsidy. Allow us to help you. It's not assistance. It doesn't affect you. It's all they care about is how much are you making per month. They're not looking at your bank account. They're not looking at anything else. Just how much are you getting every month.
And there's so many seniors that aren't aware that SBHIS is a resource that offers their services free of charge to assist you with economic needs alongside medical needs for Medicare. I can't stress enough how important that is because right now, more than anything, if you haven't reviewed your Medicare coverage or are considering a review of your Medicare coverage or find yourself in a new situation or economic experience, you need to review your formulary and you need to review your current coverage with SBHIS.
It's our pleasure to help. Our mission is to bring peace of mind and to educate every single person that we work with. We really pray and hope that you're healthy, that you understand we will come, to an end. This thing will get fixed eventually.
Now, before we break, thank you so much.
My pleasure.
It's a pleasure to have you here, and we learned so much about affordable, economic, and safe Medicare options.
No, thank you, and thank you to all.